Okay, so let's go to question two. Anemia is a condition associated with many disease processes and factors. A. State three situations in which an individual may develop anemia. B. Outline the outline the signs and symptoms of hemorrhagic anemia. C. Nursing care of patients with sickle cell. All right. Nursing care of patients with sickle cell. The first thing is to know what anemia is. Right? Anemia is actually a disease or a condition in which, when we want to look at the advanced definition of anemia, it comes as a result of the decrease in the oxygen carrying capacity of blood. That's an adult way of defining anemia. Anemia occurs when there is a decrease carrying capacity of blood. When blood is not able to carry oxygen, it results to anemia. And the anemia will be of different types. Anemia can be classified into anemia can occur basically because of various things. And you and I know that blood is formed at the bone marrow, right? And so you want to look at various types of anemia. There are more than 400, there are about 400 types of anemia. So it's so broad. We want to study the concept of anemia, we will not be able to finish it even if we take the whole academic year. So we are saying that anemia can occur as a result of loss of blood, it can come as a result of decrease or faulty red blood cell production, and it can also come as a result of destruction of red blood cells. So those are the three ways through which anemia can come in: loss of blood, decrease in the production of red blood cell or production of faulty red blood cells, and then destruction of red blood cell. Now, when it comes to anemia caused by blood loss, you can see things like iron deficiency anemia can come from there, hemorrhagic anemia can come from there, and so on and so forth. Anemia caused by decrease or faulty red blood cell, sickle cell anemia can come out from there. Macrolytic anemia can come out from there. Microlytic anemia can come out from there. Thalassemia can come out from there. Then destruction of red blood cell, hemolytic anemia can also come out from there. So you see that just these three ways of classifying it helps you, right? It helps you. You have a clear information about how anemia can be classified. So take note of these three ways that we have classified anemia. Three ways to which anemia can occur. Anemia can occur as a result of loss of blood, can occur as a result of decrease or faulty red blood cell production, and it can also occur as a result of destruction of red blood cell, right? And the destruction of red blood cell can come as a result of an autoimmune disease. So take note of that. And we are seeing state three situations in which, so you get your three marks, say outline the signs and symptoms of hemorrhagic anemia. Outline uh, 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 three causes or three signs and symptoms of hemorrhagic anemia. So that's what they're asking us. Due to hemorrhage, loss of blood, right? Comes as a result of loss of blood. So what are some of the signs and symptoms of hemorrhagic anemia? Hemorrhagic anemia can come as you can see the signs and symptoms. Start experiencing fatigue, shortness of breath, headache, dizziness or weakness, right? Dryness in the skin, fast heart rate, fast heart rate, that's tachycardia, and all of that. Somebody is introducing, I don't know whether it's a female or it's a male with a single name. I don't understand. Some of you behave like I don't know. And I'm also noticing some people leaving the group. I've seen somebody, I don't know whether surely that should be an old student. Okay, so that's what we are saying. So we are saying some of the signs and symptoms of hemorrhagic anemia. You have headache, you have fast heart rate, tachycardia, shortness of breath, fatigue, tiredness, dizziness, weakness, right? And all of that. That's what those are some of the signs and symptoms of hemorrhagic anemia. Nursing care of patients with sickle cell anemia. How do we care for patients with sickle cell anemia? Take note, sickle cell anemia occur when the shape of red blood cell has a sickle, like a crescent-shaped moon. That's why sickle cell anemia, and it's just as we given the various ways which anemia can occur when when there's a faulty production of red blood cell. And now, how do we manage? What is the nursing care for patients with sickle cell anemia? Most often at time we give them analgesic because when the crisis occur, they have pain because since blood cannot go to the capillaries, since their blood cannot go to the capillaries, since blood carrying capacity, oxygen carrying capacity of blood cannot go to capillary because of the sickle shape of the red blood cells, it makes it difficult for it to go to capillary, and so the person will be feeling excruciating pain in those areas. And when the person starts experiencing excruciating pain in those areas, the person can get into an episode. The person will be feeling dizzy, undressed because of lack of the flow of blood to those regions. And so, how do we manage these patients? We we give them a bed rest. We admit them in hospitals. The first thing is by giving infusion. We give them infusion to replenish, like they don't have enough blood, they don't have enough fluid in their blood. We give them fluid to replenish the fluid that is inadequate in their body system. We administer medications, analgesics, strong analgesics to relieve them from pain. We do a body massage of the joints, right? We massage their joints. Most often at time we can give an oxygen therapy to such patients, right? We can give oxygen therapy to such patients, right? To an extent, a blood transfusion can be given, and then you monitor for any allergic reactions, because which time any blood transfusion you give to a patient, whether the patient is whether all the cross match or the tests were done accurately, you must always endeavor to check for allergic reactions, because the allergic reactions must always occur. And when it occur, how will you manage the allergic reactions? Like some hospitals at time, when they want to administer such transfusion, they give antihistamine. That's a foolish way of managing such condition, because if there's allergic reaction, maybe the condition, maybe the blood, like it doesn't match in the body system. When you give Dexa, now Dexa will prevent it. And now when the Dexa expires in the body now, it can result to grievous allergic reactions and it will cause serious problems. So that's why we are saying that when we manage these patients with sickle cell anemia, we place them, we give strong analgesic drugs, encourage fluid intake, can give them oxygen, you can encourage, if the condition is so worse, we can do a blood transfusion, right? Give oxygen therapy. Just as we were mentioning some of the signs and symptoms of hemorrhagic shock, hemorrhagic anemia, it can also result to shock, right? So when somebody is losing blood, the person will result to shock, and that will be hypovolemic shock. And lastly, let's think of patients with that. So the next question is, as a psychiatric nurse, identify two psychotherapy methods that can be used to manage an individual with alcohol abuse, anorexia nervosa, depression. Give an example of two stabilizers. That question is A, B, C for you. Now, alcohol abuse, excessive consumption of alcohol, right? Anorexia nervosa. Anorexia nervosa is a mental disorder in which a person, how do I put it that you guys can understand? A person like prevents his or herself from eating because of how do I put it? Maybe the person wants to cut down, like some of these ladies that get around and say they want to do slim cuts, right? It worsens. It worsens, right? And so they're saying, how do we manage? What are the psychotherapy measures? Some of you may have watched this movie, uh, How to Get Away with the Murder. There's an African lady that is acting. She became so alcoholic, right? Now, when that movie is really good because they explain in that movie how you can like manage such patients, right? Such psychotherapy measures that you can use for management of such patients with alcohol abuse. You do group therapy, and interpersonal therapy. You bring them in a group, all those who are involved in that issue, and then they are explaining their situations, and then it helps the person to get relief from it. Because when you see among people who are going through the same situation, you can easily get relief from it. You can easily come out from it. The person's testimony, or the person can tell you how worse alcohol abuse has done to him or her. It can easily make you come out from it. That's what how you can do. Psychotherapy measures are those psychological measures you use in managing psychological diseases, or managing, or let me just say treatment with the mind treatment that goes with the mind, mental treatment, right? So we are saying group therapy and interpersonal therapy is a way of managing alcohol abuse. Then anorexia nervosa, most of the time, exposure therapy, group therapy, family therapy, those are the various ways that you can manage anorexia, anorexia nervosa. Group therapy, what do we mean by that? Expose a person to such people who have had like peptic ulcer because of anorexia nervosa, because of the fact that the person wants to stop eating because the person wants to do some thoughts. The person will see how people have died out of peptic ulcer. The person can change. That thing can change, can die. Family therapy, let the person explain the reason why he or she is not eating right. Then depression. Depression is always very, most often at time it's mostly behavioral therapy, social therapy, family therapy, and then cognitive therapy. Take the person away from the place of social therapy is when you take the person away from the house, person moving around, right? Most introverts, they are fond of doing that, fond of getting into depression. Maybe because of loss of somebody, loss of huge amount of money, loss of a loved one, and all of that. And so I'll allow you guys to give two examples of mood stabilizer. It's very easy. If you guys have done psychology, you guys will understand.